Dirigentes que llegan a las instituciones para desviar millones de dinero.
Leaders who come to institutions to divert millions of public money to large private companies, consequently weakening what is common to enrich a few. Those who turn health into a privilege and subordinate it to the dictatorship of money break the most basic social contract of any democratic system. And the consequences of this model are simply devastating. Only in the year 2022, 1.6 billion people, I repeat, 1.6 billion people were ruined trying to cope with health expenses. 1.6 billion people. And a quarter of the world's population faced financial difficulties for their health costs. 1 in 4 people in the world forced to choose between healing or eating. And this happens at a time of enormous global challenges. We experienced it 12 years ago with Ebola. Unfortunately, we are experiencing it again. We experienced it a few years ago, 6 years ago, with much greater harshness, with the COVID-19 pandemic. And that same fear, on a smaller scale, resurfaced just a few days ago with the outbreak of the antivirus on the ship MV Ondius. Therefore, investing in global health is investing in security for our countries and our fellow citizens. Only in the last 2 years, to give us an idea of the magnitude of the crisis that the multilateral system is suffering, the international financing for global health has been reduced by around 30%. In the last 2 years, 30%. And the consequences are already here. The reduction in infant mortality is stagnant for the first time in decades. The measles, a disease that we thought was under control, is expanding again. And if we don't act, 14 million people could die before 2030 due to preventable causes, including 4.5 million children under the age of 5. 14 million lives. Not because we don't know how to save them, which we do, but because some have decided not to do so. The greatest risk for global health is no longer the lack of science, but the lack of awareness. In just a few months, the same country that has cut around $18 billion in global health and development aid has spent more than $29 billion in a war, whose humanitarian and geopolitical consequences will also be devastating. Common sense against those who impose unilateralism against multilateralism, when the easy thing would be to retreat. And common sense placing global health on the periphery of our external action, not on the periphery of our external action, but in its very center. What happens is that in these times, excellencies, defending common sense has become a form of rebellion. Because there is a pandemic that no one wants to stop, and it is that of selfishness. That is the pandemic that is really affecting our societies, and it is also spreading. That is why, when some retire, my country has decided to take a step forward. Since I have the honor of presiding over the government of Spain, excellencies, we have doubled our official development aid. Only last year, while many other countries cut that official development aid, we have increased it by 13%, and we have committed €315 million to the global health system for the period 2025 to 2027, with contributions to Gavi, to the World Fund and, of course, also to the World Health Organization. The countries of the Global South must have the role that corresponds to them in international decision-making. We must also improve coordination and reduce the excessive fragmentation that this multilateral system still suffers. And we must place in the center the strengthening of the national health systems. Because there will be no global health security while millions of people depend on fragile or underfunded health systems. Therefore, let us never forget the greatest lesson that the COVID-19 pandemic left us, and that is that there is no possible national security in a sanitarily insecure world. Whoever has not understood this yet, after an episode like the one we lived in 2020, is either an ignorant or a fool. Therefore, let us demonstrate that we have learned the lesson, Now that the World Health Organization has declared the outbreak of Ebola in the Democratic Republic of the Congo and also in Uganda as an international public health emergency, this question of whether to help or abandon them may seem like a minor issue, after having made the decision to help them. But this question closes one of the most important dilemmas of our time, and with which I would like to conclude this intervention. Because there are still those who believe that international law is like a kind of menu to the letter, that obligations are therefore optional, that solidarity depends on convenience. The reform of global health can be done by those who cut back or those who defend a multilateral order based on mutual trust and global health public systems. Those who believe in the imposition or those who believe, as I am convinced is the majority of our societies and of course the majority of nations, in shared leadership. Those who build walls or those who understand that no one is saved alone. I believe that this is the decision that we have in front of us. Because international leadership does not consist only in having more power. True international leadership begins when a country decides to act even if others retreat.